For getting metatarsalgia is having a really tight posterior chain. Posterior chain means the muscles that run along the backside of the body. So this is your Achilles, your calf, your hamstrings, your glutes, like all the way up. Are we super tight along that back chain? Well, we have to also look at the shoes that we're wearing on an everyday basis. So
welcome back, everyone, to another episode from the Optimal Body Podcast. I'm Dr. Dom.
I'm DocJen.
And today we're going to be talking about pain in the ball of your foot, also known as metatarsalgia. So if you've been following our podcast, you know we love to talk about everything foot related, from going barefoot to different foot diagnoses. Before we jump in on pain in the ball of the foot, make sure you comment below. Or have you been dealing with any foot pain? Also, subscribe and hit the notification bell so that you can get all the videos that we put out in the future. We do so many of these podcast episodes, and Jen releases a ton of different videos on different movement variations, cueing during exercises, what you can do for different pains in the body. So make sure you subscribe to stay tuned.
So we are talking metatarsalgia, which is really that pain at the bottom of your foot, more toward the forefoot or the ball of the foot, right underneath where kind of what we call the metatarsals and the phalanges, which are our toes, right where that joint kind of meets right there. And it's usually more so in like the first, so underneath the ball of the foot, like the big toe and the second toe.
The good old metatarsophalangeal joint. Yeah, and again, it tends to mean that we are putting too much pressure, we're overstressing that area. We're going to get a little more into what causes this pain, but there's also different types. There's a primary metatarsalgia and there's a secondary metatarsalgia. Primary, when you hear primary, it tends to mean the old like, oh, you're born with it, or you were born with some sort of abnormalities in your foot that might result in you developing this metatarsalgia, putting more pressure on the heads of those metatarsals, which are at the very end before it meets the toes. Secondary means that you've developed it over time because of the mechanics of your foot or how you use your foot, and you've developed some sort of arthritis. You might start to notice a lot of callus formation, or just an aching and a severe pain kind of in the ball of that foot, specifically having to do with pressure. So if you put pressure on the ball of the foot, that would increase the pain.
So what causes this type of ball of foot pain? And where does this come from? And a lot of times, especially for athletes or people who are doing repetitive things, it can be an overtraining symptom that starts to develop, especially with that callus formation, or wearing improper shoes, or looking at gait mechanics. So we say that we're lacking our big toe extension. That toe is not coming back enough as we are pushing off in gait. That puts a lot of more pressure right at the ball of the foot. Or if we're lacking that mobility through the ankle and through the back of the calf, well, then that can put a lot of tension right at that forefoot as well. Think of it like a lack of balance throughout the entire foot complex. And this happens a lot with dancers too, when you're putting your calf in a lot of sustained isometric holds. So you're up on the ball of the foot and you're working that calf muscle over and over and over again, or you're just putting that extra pressure right at the ball of the foot. That is super common to develop in dancers as well. And sometimes just as we age, so the older that we get, we lose some of those fatty pads that we have that protect around our foot. And so with that tissue kind of becoming thinner, we could be more prone to having those aches and pains and those breakdowns kind of happen, especially if we're not balancing the entire foot. So we're really putting that overpressure right at that ball of the foot.
And this kind of comes in conjunction with other diagnoses we might hear, because, you know, we're calling this metatarsalgia as just a generalized like pain in the ball of the foot, which is kind of, it might be secondary to arthritis or some arthritic joints in those metatarsals. Stress fractures, you know, it can be fairly common to get stress fractures in different metatarsals, again, especially when we're dealing with repetitive or continual movements that we're just doing over and over again, especially with that impact, or different neuromas. You know, we had a whole episode on Morton's neuroma, and Morton's neuroma can kind of, you know, have similar symptoms to something like metatarsalgia, and Morton's neuroma actually runs between the metatarsals.
Obviously, in the beginning, when you're having having this pain, you want to start to modify your activity. So maybe instead of running, you're swimming and you're deloading the pressures in that area initially, especially when you're having a lot of that pain. We just don't want to be impacting and doing high level activity right at that area. We want to back off for the moment while you work on all these other things we're going to talk about, so that you can take off those pressures and it can start to reduce that sensitivity and that pain in the area.
I mean, if we never back off and remove the stimulus that is irritating the foot in the first place, it's going to be tough to work on the other things we need to work on, and then progress a little more thoughtfully. Or if you're like, man, I need to continue to train, I'm playing basketball or jumping or doing things like that, like you can get in the pool and still do a lot of those activities, and it again removes that impact but still allows you to develop some of those explosive muscle fibers without having the big impact on the ground when you land. So first thing is usually to calm it down.
Yeah, exactly.
Calm that thing down.
Well, and there are different metatarsal pads that you can use and you can put in shoes for, especially for people who may say you're nursing or you're on your feet all the time, you're a teacher. You know, sometimes you can't avoid being on your feet, especially being on your feet is a tough one, right? So getting a metatarsal pad, it just helps to add that padding in so that you're not getting as much friction or tension in that area that's causing the pain and the irritation in the first place. So those pads are especially good as you're starting to work into relieving that tension and pain.
Using some sort of insert or cushion that helps to reduce that sensation or that impact a little bit, even with walking, could help make things a little more comfortable to help gradually calm things down. Like you said, if you still need to be on your foot, but that's not a forever thing.
No.
At least in our opinion, that's not a forever thing.
It shouldn't be.
A lot of podiatrists might say, oh, put this insert in your shoe and you will use it forever until kingdom come.
And that's it.
Right? And I mean, we interviewed an incredible podiatrist, Dr. Emily, who we've worked with in multiple different capacities now. And we absolutely love her approach to teaching people how to work with some of the foot diagnoses that we get. But I think she would kind of agree with us in this aspect of, yes, it would be great to maybe transition. Or I've even heard her say, because one of the things we're going to talk about is using barefoot shoes or using a Vivo barefoot type shoe that has the wider toe area and the wider toe box so that your toes are going to be able to move. So we're not restricting them in tight shoes anymore. But the thing is, it has that really thin bottom. So if you do have that irritated foot, you might not want to throw your foot right into a Vivo barefoot shoe because it's going to feel even more aggressive. But I've heard Dr. Emily say before, if you have an insert, put it in the Vivo first and wear the Vivo with your insert for a while, again, to get things to calm down. And then that's where you can slowly start to remove that for an hour or 2 hours a day. And Vivos are going to be so great to help you just develop that mobility too. They're so flexible that they're going to help with your toe mobility into that extension. They're going to make your ankles work a little bit more because you're not going to have that heel lift. And a heel lift, like something like high heels, it puts you into more of a forward position.
Or even just running shoes. Running shoes have that elevated heel as well that we look at and we see all this cushioning right in the back of the heel. Well, that is naturally going to kind of shorten our Achilles and all the way up to our calf, so they're not getting that full extension as we're going through gait and walking. So we need to then stretch them even more, and we need to do all this mobility. So if we have shoes that are zero heel drop, then it teaches your body to use that full capacity of your calf muscle and your Achilles. And that's what's so important, because one of the risk factors or the causes for getting metatarsalgia is having a really tight posterior chain. Posterior chain means the muscles that run along the backside of the body. So this is your Achilles, your calf, your hamstrings, your glutes, like all the way up. Are we super tight along that back chain? Well, we have to also look at the shoes that we're wearing on an everyday basis. So we do want to be thinking about stretching a calf. You do want to be thinking about mobilizing your ankle and getting more ankle mobility. That's going to be huge to take the pressure off of what's happening in that forefoot and just distribute the pressure as we walk. So not only do we want to improve our big toe mobility, but we want to improve our ankle. We want to improve the mobility within our toes. So getting that access to spread your toes again, to move your toes is so important. And that's again why we go back to Vivo barefoot shoes.
One of my favorite combos of all time is using a Vivo barefoot shoe with our Naboso toe splays and wearing them in the shoe, and walk around with those for just 10 minutes and then take your feet out, take the splays out, and you'll be able to notice the difference just from walking around that little bit.
Or walking around your house wearing the toe splays. Now, we've been talking about these products, so I just want to let you know we do have discounts on all of these products.
We'll link both those up below. Code for both of them is optimal.
Yeah.
Managing those calluses to bring down some of the bulk of that skin tissue, that essentially scabbed up skin tissue on your ball of your foot. Bring that down so that you continue to remind yourself not to push too hard off that area.
It's really about being able to pronate and supinate. So flatten the arch and lift the arch. We have to be able to do this. Again, we just taking off the pressures initially by stretching, opening up the areas, addressing the areas above and below. We talk about this all the time, right? So if the ball of the foot is the thing that's hurting, well, how can I increase my toe mobility and start to spread out my toes? How can I increase my ankle mobility? And then I can start strengthening. Hope that helped to break it down a little bit more in your head as to what is happening in the ball of that foot and what you can do to help support your foot. That's really what we want to give you, long-term solutions, not just quick fixes, long-term solutions of what you could do to help your foot. So if you have any more questions or comments, please drop them below, and please don't forget to subscribe so you don't miss out on future PT Pearls like these or just other information and other videos that I continue to provide week after week.